human diseases don't always stay hidden inside the body. Some conditions dramatically change how a person looks on the outside. These changes can include unusual skin color, thick scales, hardened tissue, swelling, or abnormal growth of bones and organs. While many of these diseases are rare, their effects on appearance can be striking and sometimes life-altering. Some are genetic, others are autoimmune, and a few are caused by infections or environmental exposure. In this video, we'll explore several diseases and conditions that significantly change a person's physical appearance, along with what causes them and how they affect the body. Vitiligo. Vitiligo is an autoimmune condition that causes the skin to lose its natural pigment. It happens when the immune system mistakenly attacks melanocytes, the cells responsible for producing melanin, the pigment that gives skin, hair, and eyes their color. As these cells are destroyed, patches of skin gradually turn milky white. These patches often appear on the face, hands, arms, feet, and around body openings, such as the eyes or mouth. In many cases, the patches appear symmetrically on both sides of the body. Hair growing in affected areas may also turn white. Vitiligo occurs in people of all skin tones, but it is usually more noticeable in individuals with darker skin. The condition is not contagious and does not physically harm internal organs. However, it can have strong psychological and social impacts due to the visible changes in appearance. There is currently no cure, but treatments such as corticosteroid creams, phototherapy, and skin camouflage techniques can help restore or even out pigmentation in some cases. Psoriasis. Psoriasis is a chronic autoimmune disease that affects the skin. In this condition, the immune system speeds up the life cycle of skin cells. Normally, skin cells grow and shed over about a month. In psoriasis, the process can occur in just a few days. This rapid growth causes skin cells to build up on the surface, forming thick, raised patches called plaques. These plaques are often red or purplish with silvery white scales. They commonly appear on the elbows, knees, scalp, and lower back, although they can occur anywhere on the body. Psoriasis may cause itching, burning, cracking skin, and in some cases bleeding. Some people also develop psoriatic arthritis, where the immune system begins attacking the joints. The exact cause is not fully understood, but genetics and immune system dysfunction play a major role. Stress, infections, and certain medications can trigger flare-ups. While psoriasis has no cure, treatments such as topical medications, light therapy, and biologic drugs can greatly reduce symptoms. Ichthyosis. Ichthyosis refers to a group of genetic skin disorders that cause extremely dry, thick, and scaly skin. The name comes from the Greek word for fish because the skin often resembles fish scales. In many forms of ichthyosis, the skin sheds abnormally slowly, causing layers of dead skin to accumulate. The result is rough, cracked skin that can appear in plates or scales across the body. Some forms are mild and cause only dry skin, while severe types can significantly restrict movement and lead to painful skin cracks. In certain cases, babies are born with a severe form known as harlequin ichthyosis, where thick, armor-like plates cover the body. These plates can limit movement, breathing, and temperature regulation. Although there is no cure, treatments focus on softening and removing the thick skin with moisturizers, exfoliating creams, and medications like retinoids. Proper skincare can greatly improve quality of life. Scleroderma. Scleroderma is an autoimmune disease that causes the body to produce too much collagen. While collagen normally supports skin structure, excess amounts make tissues thick, stiff, and hardened. In localized forms, small patches of skin become shiny, tight, and discolored. In more severe systemic cases, the disease can also affect internal organs, such as the lungs, heart, and digestive system. When the face and hands are involved, the skin can tighten so much that facial expressions become limited, sometimes creating a mask-like appearance. Fingers may also stiffen or curl inward due to reduced blood flow. Many patients experience Raynaud's phenomenon, where fingers turn white or blue in cold temperatures. Although there is no cure, medications can help control symptoms and slow progression. Acromegaly. Acromegaly is a hormonal disorder caused by excess growth hormone in adults, usually due to a benign tumor in the pituitary gland. Because the condition develops slowly, the physical changes may go unnoticed for years. Over time, people develop enlarged hands and feet, along with more pronounced facial features such as a protruding jaw, thick lips, a larger nose, and a prominent brow. The skin may thicken and internal organs can enlarge as well. Symptoms often include headaches, joint pain, sleep problems, and vision issues. Treatment usually involves surgery to remove the tumor or medications that reduce hormone production. Elephantiasis, or lymphatic filariasis. Elephantiasis is a severe disease caused by parasitic worms spread through mosquito bites. The parasites damage the lymphatic system, blocking the flow of lymph fluid and causing extreme swelling in body tissues. The legs are most commonly affected, but swelling can also occur in the arms, breasts, or genitals. Over time, the skin becomes thick, rough, and hardened, giving it an elephant-like appearance. The disease mainly occurs in tropical regions. Early treatment with medication can stop the infection, but advanced swelling may become permanent. Argyria. Argyria is a rare condition that turns the skin bluish-gray. It occurs when silver particles slowly accumulate in the body, often from long-term exposure to silver dust or the consumption of colloidal silver supplements. When silver deposits in the skin, it reacts with sunlight and oxygen, causing permanent discoloration. The change is usually most visible on the face and hands. Although Argyria generally does not damage internal organs, the skin color change cannot be reversed. For this reason, health authorities warn against ingesting silver-based products. Proteus syndrome. Proteus syndrome is an extremely rare genetic disorder that causes abnormal and uneven growth of bones, skin, and tissues. It is caused by a mutation in the AKT1 gene that occurs after conception, meaning only certain parts of the body are affected. This leads to asymmetric growth, where one limb or body part becomes much larger than the other. Tumors, thickened skin, and unusual bone shapes may develop. The condition usually becomes noticeable during childhood as growth continues. Proteus syndrome affects fewer than 1 in a million people. One of the most famous suspected cases was Joseph Merrick, often known as the Elephant Man. There is no cure, but doctors focus on managing symptoms through surgery and supportive care. These conditions show how certain diseases can dramatically change a person's appearance. Beyond the physical symptoms, many patients also face emotional and social challenges. Understanding these disorders helps reduce stigma and highlights the importance of medical research and compassionate care.